Hi everybody, it's Adam, the geneticist and next generation sequencing data scientist here at Verdure Healthcare. Thank you very much for watching my Facebook premiere, and I would like to welcome you to this session on chromosome 6 and the infant kidney diseases related to it. Now, you should know there are 23 chromosomes in our human body. And the chromosome 6 is located here if we were to line up all the chromosomes, and it will be the 6th largest chromosome in the human body. Right, even though that's the case, it makes up for about 5.5% of our total genes. So just in case if you've forgotten about the relationship between the chromosome and the DNA or the genes, let me give you a refresher. So imagine chromosome like a ball of string that you just purchased from Mr. DIY. And if you pull out the strings from this ball shape, then it will be very similar to pulling out the genes and DNA from the chromosome. So it is exactly on the same scale. Now, there are 4 kinds of DNA pieces, what I would say in layman terms, and they include G, C, A, and T. You don't really have to remember the names, and they are really difficult to remember anyway, but what I hope you can understand is that these GCATs are called the nucleotide base pairs. Okay, so these are the so-called DNA pieces. And how do we know whether a person is sick genetically? So we can line up all these GCATs, all these huge data, and we compare them to a reference genome, which is a normal human gene. We'll be able to see if there are extra pieces of, for example, G and A's, or if there's any missing C's or any substituted ones. For example, this piece is supposed to be G and it was replaced with a T, for example. Then there will be something wrong, and we will see according to, and also depending on what change has made, what kind of disease it has caused a human. Right, so chromosome 6 has over 171 million DNA pieces. Okay, so that's a lot, and I'm not sure if you can see any of these, but these numbers, they record the regions of a chromosome. So if you can see, there are some numbers, for example, 6q 1.3, for example, then it will mark the region in this chromosome 6. So for diseases that cannot be named or doesn't have a name at all, they would usually use this particular information to name the disease. Right, and there are certain diseases that I really want to focus on in this session. So it includes the transient neonatal diabetes mellitus, chromosome 6 ring syndrome, partial trisomy 6q, autosomal recessive polycystic kidney disease known as ARPKD, and then also schizophrenia. Okay, it's a psychological disease, and they are the more common ones, the diseases that are included in chromosome 6. Okay, let me give you one more refresher before we step onto chromosome 6. There are 2 kinds of genetic diseases. One is single gene disorders. For example, the one that we talked about briefly just now, for example, if a G has been missing or an A has been replaced with a C, these are very, very small details. So if there's something wrong with that level, it's called single gene disorders. Chromosomal abnormality involves the entire chromosome. So the first slide I showed you just now, if you are able to see it at this particular level, then it is very obvious. Then it will be called the chromosomal abnormalities, and it will usually be very severe. Okay, so let's go by alphabetical order. So let's talk about autosomal recessive polycystic kidney disease. ARPKD. Wow, It's a long name. Now, okay, if you were to go and search on Google, I would strongly suggest you viewers' discretion is advised. Okay, so that's why I'm not putting any real pictures in here. Not everybody can accept that, how it looks. Okay, anyway, what is this ARPKD? So usually it affects 1 in 20,000 children, but still that is quite a high number in terms of genetic diseases, whereby the kidney is full of fluid-filled cysts. Okay, now cyst is not a tumor, it's not yet a cancer, something like that, but there can be some potential whereby some of these cysts can grow into a lethal cancer or a lethal tumor. Right, so if that's the case, it's going to enlarge the kidney. And when it gets enlarged or too big, it's going to cause the child kidney problem, even though when this baby is still inside mommy's tummy, meaning the womb. Okay, now here's the reality. Majority of chances are the fact that it's going to cause breathing problems. So as you can see, if you cannot breathe properly, then there will be a high chance of not surviving. Okay, so it threatens the life of the fetus of the baby, and about 30% of the newborns die within the first week of life after birth. Okay, so that's quite a high number. Anyway, a baby with this particular disease that can survive the first few weeks, most likely they are strong enough to survive into adulthood, but the thing is that this particular kid will need treatment throughout his or her life. Okay, so this is a very severe disease, and as you can see, this is an MRI picture, and as you can see, the kidneys has grown to the size of a rugby ball, so it's this big, and it's a horrible disease. Okay, and when we move on to the next disease, chromosome 6 ring syndrome. So as the name you can tell, ring syndrome. What happened over here? Now this is a chromosomal abnormality. Just now, the kidney disease is a single gene disorder. Now it is the chromosomal abnormality, whereby, if you can imagine, this is chromosome 6. The top end and the bottom end is missing or has been deleted. As a result, these two ends would stick together, okay, just like a magnet, like that. So this is ring chromosome, and if you can put that, okay, in a chromosomal lineup, it's called karyotyping. As you can see, this is what's going to happen. Okay, so this is this is pretty much the philosophy of this disease, but what is it going to cause? So as mentioned just now, chromosomal abnormalities, very often they will be very severe and they're going to cause a huge amount of problem. For example, growth retardation. Retardation meaning to say the baby is growing very, very slowly. Okay, so a various degree of mental retardation despite growth retardation, and severe delay in learning a particular skill, yeah, and it's called the psychomotor retardation. And then, from the looks of this particular kid, you'll be able to see that he or she is special because the craniofacial features within this region is very different compared to a normal child. Right, so here are some examples, okay? So there we go, ring chromosome 6. I'm not sure if you can see that very clearly. So here's the ring, okay, and then double ring. Okay, chromosome 6. There, it is a possibility as well. It looks like 100 over here. Anyway, okay, now this is interesting. Another chromosomal abnormality. And then, okay, if you have been listening to my lessons previously, by now you should know what is trisomy. So let me give you a refresher anyhow. For example, like Down syndrome. It is on the 21st chromosome, there is an extra piece. So instead of only 2 chromosomes, there are 3 right now. So partial trisomy. what on earth is that? Okay, it is not full trisomy, whereby there's an extra chromosome 6, no. So, okay, this is the normal chromosome. Now the drawing is not very good, okay, so here the chromosome 6, but there are pieces in here, okay, the short arm of the chromosome that gets duplicated 3 times, okay? So you can't see an extra chromosome here, but instead this piece has been elongated to such an extent whereby if we were to sequence these data out, you will see that there are 3 copies of this particular information. Alright, so yeah, okay. And if you are still struggling with the understanding of it, please do let me know so that I can help you further with that understanding of partial trisomy. It is very tricky. Okay, so what's going to happen? Just like ring chromosome, because there are things that have been deleted on the larger scale, duplicated, not deleted, duplicated on the larger scale, there will be problems such as mental retardation, a delay in acquisition of skill, just like the previous disease we just talked about, okay, and a distinctive malformation of the skull and the craniofacial region, okay? Yeah, and pretty much it is quite similar to the disease, the ring chromosome that we just talked about. Right, so here are some real cases. Okay, so this is normal. Okay, this is normal chromosome, but as you can see, this particular chromosome has been elongated. Okay, now the name itself is already difficult enough to pronounce. Schizophrenia. Okay, it's not prenia, it's phrenia. So for some of you who understand Chinese, it is 精神分裂症. Okay, it is a scary word, isn't it? So yeah, there's a prevalence rate about 0.5% to 1% in child, and it is a devastating disorder. It can be devastating. So in some more serious cases, this particular child will be trying to suicide, will be trying to hurt him or herself. There are cases whereby they took out the entire teeth, entire set of tooth and teeth. Okay, so that's something very scary as well. Okay, so now what happened is that, as you can see, this is a healthy brain and this is a schizophrenia brain. So there is this activity change, and then what happened is that, okay, there has been a major histocomplexability region in the chromosome 6 that has a mutation. Okay. Right, now, the last disease we're going to talk about in chromosome 6 is the transient neonatal diabetes mellitus. Okay, so it is a newborn infant diabetes, at least it's one of it. Okay, so usually what happens is that when the baby is born, you will be able to see symptoms. Okay, what are the symptoms? Such as, okay, dehydration and failure to thrive in infancy, hyperglycemia, meaning to say that there's extra blood sugar in the blood, okay? Right, so for this particular disease, what happened is that in the region of the long or the Q arm of chromosome 6 there has been a mutation. So this region is called 6q24. Now, does that ring a bell? So just now we talked about the regions of chromosome 6. 6q24, so that's how the data scientists or the geneticists will be able to locate, okay, so here it is, 6q24, okay, in the long arm of this chromosome 6, there's something wrong with it. So in the future, if there are any genetic therapies currently which is available, then we will be able to pinpoint at that and do the necessary treatment. Okay, so speaking of treatment, what are the possible treatments for genetic diseases? Okay, but now everyone, I have to warn you, because currently genetic treatments or therapies, they are more like a science fiction rather than a reality or a practical solution. So the best way is really to prevent this thing from happening. So if there is a mutated gene, then the most obvious way would be to replace the gene with a healthy gene. But if it causes a mutated protein, we will try our best to do something called the protein replacement. Okay, metabolic dysfunction, meaning to say that in the body there has been some chemicals that cannot be balanced. So in that case, there can be diet modification or some pharmaceutical or pharmacological agents that can balance it out, the areas of metabolism, or in a more severe form, just like the kidney disease, you might need a total transplantation of the organ. Yeah, so okay, all of these, it sounds expensive, it sounds troublesome, and they are. So the best way is to do the genetic test necessary to know that, okay, you yourself, do you have this particular mutation that you are carrying, but it will not affect you at all because you are only a carrier of that particular genetic disease. So through genetic testing at Verdure Healthcare, we have something called the pre-pregnancy DNA screening. So as you can tell from the name, this is the test that you should be doing before you plan for pregnancy, whether you're deciding to go for IVF or even natural pregnancy. Okay, so there's a question you might be asking, Adam, why do we need to do such a genetic test? You know, is it troublesome? No, it is not troublesome at all. It is in fact very convenient. You really don't have to do anything except take the blood, about 10 milliliters of blood, and we will be able to help you do this particular test. And it is available here at Verdure Healthcare, the phlebotomists. So the thing is that, okay, back in 2015, the University of Chicago School of Medicine had made a statement. Humans carry 1 to 2 lethal recessive mutations on average, study estimate. Okay, let me translate that into layman language, whereby healthy human beings, at least looking from the outside of it, just like you and me, actually we are at least carrying 1 to 2 genetic mutations. Okay, so here's the next question. So what? If I'm carrying mutations, so what? So humans carry on average 1 to 2 mutations that, if inherited from both parents, can cause severe genetic disorder or death before reaching the reproductive age, report scientists from the University of Chicago and Columbia University. So Columbia University is also a very famous and it's also a very well-known university in the United States. So they work together to produce this kind of research. So as you might be able to understand from my reading just now, so if let's say the mother has got the kidney disease that we just talked about, and the father has it as well, but they are not affected because they are only the carrier of this autosomal kidney disease. So if that's the case, if both parents are passing on this kidney disease gene to the baby, then there will be a 25% chance of this baby getting the polycystic kidney disease, right? Okay, so that is why at Verdure Healthcare, our pre-pregnancy DNA screening are separated into 2 reports, okay? On the first report, you'll be able to see all of your chromosomes, okay? So we will be able to detect, touch wood, if there's ring chromosome, there's extra pieces, partial trisomy, something like that, and here it is. So deletion, meaning to say that this is the normal chromosome, but there are regions that have been missing. Okay, duplicated, for example, partial trisomy or duplication. Inversion, okay, whereby these 2 regions flipped around, okay, they swapped and flipped up and down. Substitution between 2 different chromosomes, for example, chromosome 4 and chromosome 20. Something from chromosome 4 has gone to chromosome 20. But here's the thing, friends. If you have a substitution, can you guess whether or not you, yourself, as an individual, do you think that you were going to have a problem? Let me give you 5 seconds to have a think about it before I give you the answer. Right. Any ideas? Any idea whether or not will you be having a problem? Let me tell you, the answer is no. You, yourself as an individual, will not have any problem. Why? Okay, so you see, there is no gain or loss of genetic information. Okay, it is simply a substitution. So you yourself, since you have no extra or less genetic information, there's no problem for you. But if you're passing on this substituted chromosome to your next generation, will there be a problem? Yes, definitely. Because the baby, the receiving person, will be having either extra or less genetic information, right? So previously we had a client just like this, and his wife miscarried 7 times. 7 times. So when he comes to us, okay, I explore every thing that is possible, and I saw this substitution. And at the end, we have to bootstrap and we have to strengthen their reproductive health, okay, and send them to IVF. And in a way, that will increase their chances of success since we are preparing them to do it. Okay, translocation, often known as balanced reciprocal translocation, whereby 2 chromosomes, instead of, okay, what's the difference between this and this one? This one is a single direction, okay? So chromosome 4 giving something to chromosome 20. But translocation, whereby they exchanged things, chromosome 4 exchanged this region to chromosome 20, and chromosome 20 exchanged this region back to chromosome 4. So in that case, you yourself, if you have this particular problem, there will be no symptoms at all. So that is the danger, okay? Now, okay, you might be thinking that, okay, what on earth is this? Don't worry, I'm not going to go into details, but anyway, for the second part of the report, we will be screening 169, yes, you've heard it right, 169 Asia's most common genetic diseases, just like the one that we've spoken about. For example, thalassemia, muscular atrophy, something like this. And it is an extremely hard process. It is a very long and difficult process in order to extract all the DNA and line up all the nucleotides or the GCATs. So it is a very advanced technology, and I myself, you might be thinking, oh, why did I introduce myself as the next generation sequencing data scientist? Next generation sequencing is this, what you're looking at over here, to screen out the genes and to line them up. And then the data scientists, just like myself, we're responsible for compiling them and produce a meaningful report to help you make the most and the best cost-efficient fertility solution. Okay, so here's the sample report. So this particular lady over here has beta thalassemia, Smith-Lemli-Opitz syndrome, and the Wilson disease. All these mutated genes have been carried on her body. But luckily, her husband don't have any of these problems, so they are able to get pregnant naturally. Okay, so now after the screening, the most important thing is risk analysis to see if, let's say, dad is a carrier and mom is a carrier of the same disease, there will be a 25% chance that this child will really be affected by the disease. 50% chance that this child will be carrying the disease but will not be affected, and there's only 1/4 chance that this child can get away completely. Okay, but we must know about this analysis. Okay, and so that's why we need a qualified person to do it. And okay, you might be wondering, okay, Adam, if that's the case, are you a doctor? Actually, I'm not a doctor. So I have a postgraduate certificate in surgery from the Royal College of Surgeons of England, and I'm qualified as a surgical first assistant and also an instructor of surgery. Although I don't teach surgery right now, I do prefer talking about genes a bit more. But if that's the case, then we need extra qualification, because doctors, medical scientists, or even a surgical instructor like me, we are not automatically qualified to talk about genetics, okay? So whatever we had previously is just a medical-based qualification. And if we want to speak about genetics, we have to get a more advanced level qualification, such as this one that I've obtained from Stanford University. And so just now, even then, it was a foundational certification to certify me as a geneticist. But if I want to offer you genetic tests, just like the pre-pregnancy DNA screening, I have to get another qualification, which is in genetic testing and sequencing technology. So this one, I received it from Harvard Medical School. And last but not least, my data scientist certification is from Johns Hopkins University. So in genomic data science. So this is the one that I've been talking about just now, about next generation sequencing and how the nucleotides of GCAT just now have been lined up. Okay, anyway, so you might have heard of commercial genetic tests such as 23andMe as well as Circle DNA. And these are fantastic genetic tests for your well-being. So they are quite different compared to what we have because these called commercial DNA tests, they are to guide you on how to exercise, how to eat healthily, how to eat the nutrition that you particularly need. But for the pre-pregnancy DNA screening, we have to take your blood, okay? So when taking your blood, only then we will be able to do such advanced next generation sequencing. Okay, so, I almost forgot. Commercial DNA tests, usually they will take your saliva. So how do you order it? Okay, you go onto the relevant website, you order a package, they will courier it to you, and then all you need to do is just to take a saliva sample, put it into the tube, and send it back to them, and hopefully they will be able to produce a report to you within a month. Okay, so for us, because there are medical decisions that has to be made based on this particular test, so we have to take blood samples. Okay, step 2, regardless of whether or not there is a mutation in your test or there is none, then we will need to enhance the quality of your eggs and sperm cells, okay? Because that will strengthen your fertility. One is that it will increase your chance of a natural pregnancy, and the other one would be to prepare yourself to do IVF and increase the chance of success. So it is very beneficial to, first of all, enhance the quality of your sperm and egg cells. And with that, we have won the Baby Talk Mama Papa Magazine Reader's Choice Award 2021. So we do have 3 kinds of supplements to help you enhance or to boost your fertility. For example, our VHC formula Female 1 and Female 2. Female 1 is to enhance your ovulation function and the quality of your eggs, pinpointed at 2 of these functions. Female 2 would be to enhance the environment in the endometrium. Okay, so it is building a suitable environment for the embryo to be implanted. And as for men, we have the VHC formula male, whereby it enhances the sperm's quantity and quality in terms of its swimming capabilities, its shape, and etc. And also, one of the special products that we have won this award is the confinement. VHC Confinement 1 and Confinement 2, usually in a package whereby, okay, it helps you to recover after labor, labor meaning the delivery of the baby. It helps you to recover holistically and also to help you prepare for your next baby. And also, I would like to really take this opportunity to thank everyone for your support, even though there are some of us who haven't seen before, but I would love to thank you for your support by watching my channel, because our method of operation and our brand has been awarded Super Brand Malaysia 2021. So this is a very prestigious award whereby there is a judge panel of 3,000 judges and we pass through all of them. So really thank you so much. Okay, step 3 would be to literally get pregnant. Okay, but it really depends on whether or not do you have genetic mutation being carried on you. If, okay, the more ideal result would be there's no genetic mutation at all. In that case, the solution to help you would be the home artificial insemination IUI. Yes, you have heard it correctly. It is like doing IUI at home. Basically, all you need to do is just 3 simple steps. First of all is to chart your ovulation. Second step is to confirm that you're ovulating. And the third step would be to use the equipment, the IUI kit that we've included in the package to collect the sperm and inject the sperm directly into the uterus. It is a shortcut, isn't it? And you don't have to go to the hospital. You don't have to spend a lot of money because this package is only 1/50th. Yes, 1/50th price of a traditional IVF. Okay, and plus you get all the privacy. You can do it whenever you want, but it is just strongly recommended that you do it during the ovulation. And okay. For this particular kit, it is rewashable, so you don't have to dispose it at all. All you need to do is just mix water with some alcohol, then wash it thoroughly, then you can use it next time. Okay, so let me go into the details a little bit. First of all, when you are predicting your ovulation, how do you do that? Basically, all you need to do is just to record your menstrual cycle. Okay, there will be a detailed information on how to do it when you purchase this package. So the thing is that if you're ovulating, there will be a bump of temperature, body temperature, what we call, because the body is producing a hormone called the luteinizing hormone, or LH in short, which would bump up your body temperature by 1 or 2 Fahrenheit, okay? 1 or 2 degree Fahrenheit, I should say. So we would have, you would need to purchase just a Fahrenheit thermometer, and you will be able to measure the body temperature every morning before you get up. Okay, so the second step is to confirm ovulation. So when you've reached this step, okay, most likely you have already been recording your menstrual cycle for 1 or 2 months. You will be able to see a pattern. So during this temperature bump over here in your next cycle, okay, so around this time you will be using this ovulation test kit, and we have imported these test kits from the UK, and they are really high quality. So in that case, you'll be able to see, okay, positive that you are ovulating, negative, you're not ovulating, or invalid. So in that case, you might have to do the test again. So if you're tested positive, okay, that means you're ovulating. The next step is to use the home artificial insemination IUI kit, okay, which is of course included in the package. And all you need to assemble the connectors together, assemble the big piece of equipment over here, and then on the day, ask your partner to produce a sperm sample, okay, take it with Sinridge, okay, connect it with the connector and the IUI kit, and then inject the sperm into the uterus directly, okay, so it is a shortcut. Right, so who's suitable? Okay, there might be people who feel very stressed during ovulation. So in my experience, there are, the male partner that is saying, okay, I'm just too stressed to do any intercourse on the day because the wife is ovulating. So there are certain cases like this. If that's the case, then this kit is definitely for you. But for male with lower sperm count, lower sperm swimming capability, or poor sperm shape, first of all, I would strongly suggest you to use our VHC formula male. Take it for around 1 to 2 months. At least it will improve your sperm quality and quantity. Then use this kit. For ladies with high amounts of antibodies that would kill sperms and suffering from recurrent genital infection or pain during the intercourse, then this home artificial insemination, IUI, is for you. Right, here's the thing. What happens if you do have mutation? And in this case, our direction would set course to an IVF treatment. Why? Okay, so what's about IVF treatment that is so special? Okay, we want the embryo genetic testing, and it's called PGD-PGS. PGD stands for pre-implantation genetic diagnosis, and PGS stands for pre-implantation genetic screening. Are they the same thing? Not exactly. PGS is to screen for your chromosome, so it's the big picture. PGD is to screen for specific diseases. But, okay, PGS or PGD, when are they done? Okay, so they are done after when the sperm and the egg have been fused together in the IVF laboratory and had been incubated in the artificial womb for around 5 to 6 days. So right before the time the doctors put this embryo back into you. So this is the golden time to do it. And the thing is that because of its nature, whereby the embryo, there will be a needle sticking inside the embryo to take a piece of it off to do the testing. So when you hear this, okay, you might be worrying, oh, will that hurt my embryo or baby? Honestly speaking, there is a chance. I can't guarantee that there will be 100% chance that the baby will be hurt or 100% chance that the baby won't be hurt, but there is a risk, okay? So that is why, even though if there are genetic mutations that you and your partner are carrying, matching ones, there's 25% chance of the baby getting the disease. You need to go for this, but still, we strongly advise you to boost up your reproductive health in a way that will enhance the quality of your sperm and egg cells, so that when they are made into an embryo, there is a better chance of it surviving the PGS-PGD process. Okay, so despite the nature of it lowering down, not increasing, because most likely the embryo will be hurt, the second thing is that money. Okay, money is one of the factors you need to consider, because if you go to Google and you search PGS-PGD cost in Malaysia, the answer is about 35 to 50,000. So that is quite a lot of money. And okay, need not worry, because at Verdure Healthcare, we are a fertility center because we are offering the home artificial insemination IUI, but we do work with, for example, Alpha Fertility, TMC Fertility Center, Sunway, Thompson, and yeah, all of these fertility centers, and we will be able to follow up upon a case if we were to refer you to them for IVF treatments. We also work with DNA laboratories and genomics lab, and these two labs are responsible for testing genes. Okay, PathLab, Sonovision, and Gribbles, as well as BP, they are here to help us do the blood test. So after you've taken, for example, VHC formula, female 1 and female 2 for 3 months already, you want to see, you would like to see an improvement. So that is why we have blood testing package specifically tailor-made to reveal how healthy you are on the reproductive health. Right, on the very last note, I want you to remember that your genes will determine the baby's lifetime health. And especially when genetic diseases, they are very difficult to cure, if not no cure at all. So we have to work our best to avoid it and to prevent diseases, genetic diseases from happening to our child. So I hope you've enjoyed this session, and I hope you found it informative. And if you are planning for a pregnancy, please do give us a call at our customer service hotline over here, okay? And our relationship managers will be able to answer your inquiries. And then, yeah, so this video will be put on YouTube as well. Please don't forget to click like, subscribe to our channel, and share this particular video to the friends and family members that are planning for a pregnancy. Thank you very much, and I will see you very soon for Chromosome 7.